Hello, friends. Welcome to In Udder Words with Lacey P., your Dairy West Farmer Relations Manager. In today's episode, we're going to talk with Ann Lakuta. She's a member of our health and wellness team. She's a registered dietitian, and she leads our work with health professionals. Welcome, Ann.
Thank you, Lacey. I'm excited to be here.
I'm very excited to interview you today. This will be a lot of fun. So jumping right in, health professionals have been top of mind for everyone lately, and I know that you do a lot of work with them. Can you tell us why it's important for us as a checkoff organization to do work with our local health professionals?
Yeah, absolutely. So there's a couple different reasons. One of them just being that health professionals are thought leaders and influencers in our communities. They have been for years and years, and they still are. People go to them for trusted advice on nutrition, health recommendations. And so as a dairy checkoff organization, we want to make sure that we're engaging with them to make sure that they do have the most updated information on general nutrition, but more importantly, how dairy fits into that healthy eating pattern. And then another thing that comes to mind, so consumers are starting to wonder, where does their food come from? And they're asking health professionals that question. So they're going to their dietitians, they're going to their doctors, and they're saying, hey, how is my dairy produced? Where does it come from? How are my vegetables grown? And most health professionals don't have a background in agriculture. And so, as a checkoff organization working for farmers with a direct link to farmers, we can serve as that source of information about agriculture for this health professional audience.
That's awesome, Anne. I think that's a really important connection to help those farmers get a little more understanding about where food is actually coming from. Can you give us some other examples of the health professionals that you work with?
Yeah, absolutely. So it's probably, who would come to mind. So it is your doctor, it is your dietitian, it's your nurse, your PA. So those healthcare practitioners that are doing direct work with patients and seeing patients one-on-one on a regular basis. But we expand that definition a little bit and do a lot of work with community health workers and public health professionals as well. So it's your health professionals that are working directly with patients, but also those that are planning programs for their communities. And then lastly, our one big overarching criteria for, narrowing down the health professionals that we engage with is that they do nutrition related work. And so we want to make sure, we're working with pediatricians and family physicians that are talking to their patients about their eating patterns. And then again, those community health professionals and public health professionals that are working on food assistance programs and nutrition programs for their neighbors and the communities that they live in.
You're doing work with so many different health professionals, and it's really amazing. And I'm grateful that you're doing this work on our behalf. It's awesome. My next question is, Dairy West's mission is to inspire trust and increase demand for dairy products. How does the work you do with health professionals align with that mission?
Yeah, that's a great question. And I want to just back up and, say thanks to all of our farmers, because the work that we do is 100% possible because of them. And so, everything that we're doing is on their behalf. So thank you again. But so going back to your question, our work supports Dairy West's overall mission in a couple of different ways. And we kind of have sub goals that lead up to that overall mission. And so one of them is to position Dairy West as a credible source of nutrition information. And so we want to be the go-to website, the go-to organization, the go-to people for health professionals to come and find information on nutrition and on agriculture and on sustainability, and specifically dairy nutrition and dairy farming. And then our second sub goal is to serve as this convener of thought leaders. And so we really put a focus on organizing events, networking virtual events, and educational sorts of offerings that bring thought leaders together. So people that are doing work in this nutrition and health space can get to know each other, can get to know what other people are doing, in their communities in Utah and Idaho, but we can also share with them what we're doing. And so in that way, people can identify us as a partner, and we can also pursue partnerships with other organizations that are working towards similar goals. And so, ultimately, we want people to see us as that credible go-to source of information, but also as a valuable partner, and also to identify dairy foods and dairy farming as an integral component of this healthy and sustainable community.
Well, great job at creating those partnerships, Anne. That's definitely good work that needs to be done. So, Anne, what exciting projects do you have coming up for the remainder of the year?
Oh, that's a great question. And we have a lot in the pipeline, but I have two that I think are especially relevant to share and I'm especially excited about. So the first one is a good example of an innovative way to approach education for health professionals, but this particular program is actually open to anyone in our region. And actually we have people across the country signing up for it, which is very exciting. But Dairy World Tour is a new program that we're launching in 2021. It's unlike anything that we've ever done before, really. And the idea came from, we just got out of a year where a lot of people had to cancel travel. We were really missing, foods from around the world and around the country. And so Dairy World Tour is a way for us to encourage people to explore global cuisines, but also to see how dairy is used in cuisines around the globe, and to show them how they can use local dairy while creating some of these fun, different dishes in their own home. And so the way it works, every other month throughout 2021, those that registered will receive a dairy product box and access to live episodes that feature a certain country. And so, for example, in February, we're featuring Italy. So everyone that signed up will receive a dairy product box that has local Utah and Idaho dairy products, as well as recipe cards that feature Italian dishes that use those products. And then they'll be able to access a live episode that features a culinary expert and a nutrition expert exploring the country's culture, cuisine, kind of one-on-one facts about the country, and then, of course, how dairy is used there. So it's a really fun way for us to approach education, get people excited about food, but most importantly, get people excited about local dairy foods. And then the other one is another example that kind of represents this convening thought leader goal, and the importance of pursuing innovative partnerships with other organizations in our region. And this one is called Food Pharmacy. And so it basically prioritizes food as medicine in the healthcare system. And so this is a movement that is taking place all across the country. It has yet to really occur in our region. And so we are working on partnering with some local healthcare systems in both Utah and Idaho to launch this food pharmacy concept. And basically what it does is it connects a patient when they go to their doctor's visit directly with healthy food at that visit. So there are a lot of details that would be involved, but it really highlights dairy because dairy is recommended in the dietary guidelines for Americans. And there is loads of science that show that dairy helps prevent all sorts of chronic diseases and can help manage them as well. So it is a really important food in the healthcare setting. So that's another project that I'm really excited about. If we end up working with some of these healthcare systems, it will involve doctors, it will involve nutrition care service administrators, it will involve dietitians. So a really great example of this cross-collaborative project that involves a lot of different types of health professionals. So stay tuned for more details on that one.
I'm so excited about both of those things, Anne. It'll be fun to do some traveling and kind of virtually get to visit Italy while tasting some of the treats. And I'm excited to be a part of that. So thank you for joining, Anne. I've loved hearing what you're doing with your health professionals.
Yeah, thanks for having me, Lacey.
You're so welcome. Thanks for joining in Udder Words. Go out and milk your day for all it's worth.